Many hospitals across the country and around the world are keeping their eyes on Omicron, including the Medical University of South Carolina. Today, I speak exclusively with MUSC Health CEO Dr. Cawley for this edition of Quintin's Close-Ups. And if you haven't already, subscribe to my YouTube channel and like Quintin's Close-Ups on Facebook. Dr. Patrick Cawley, welcome back to Quintin's Close-Ups.
I'm happy to be here.
I appreciate it greatly. Obviously, you're the CEO of MUSC Health and the Vice President for, obviously, Health Affairs at MUSC. And now, you guys are obviously busy with a whole lot going on with COVID and the potential of the next variant that's going on right now. According to scientists, the B11529 Omicron or Omicron variant is a newly identified strain of the coronavirus with 30 plus different mutations, that is, in the COVID-19 spike protein, which makes the process of its transmission obviously easier. Where are you mentally with this?
Well, a couple things. So this is the first time that the public health authorities have gotten out in front of a virus before we know that it's definitely a problem. So it theoretically is a problem, but we don't have the data yet to show that it's definitely a problem. So I think it's one of these things that we need to watch. We'll probably have some data in about 2 to 3 weeks as we know how it's affected, particularly countries like South Africa and other places where it's prevalent at the moment. So this is one of these things that I would watch, but I wouldn't get overly, upset about it and try to avoid it at the moment. It wouldn't be surprising though. If this does come forward, because this is kind of what happens, and there are other illnesses like flu. We're very used to flu changing every year, and some years it's worse than others, and some years we have to modify the vaccine. So I'm not surprised, but I think watchful waiting is the word at the moment.
And Dr. Cawley, let me ask you, how will you sequence for this Omicron?
Well, at MUSC, we actually do genetic sequencing of different COVID samples that come into our lab on a regular basis. So we have not yet seen Omicron here at MUSC. The second that we do see a case, we'll let the public know. But I wouldn't be surprised if we start seeing it within the month.
Wow. And typically speaking, when it comes to these types of variants, what is the sequencing capacity that is, say, for here in Charleston County?
Well, that's a good question. I know that we sequence several thousand samples a month, which is a pretty good sample. I do also know that DHAC does sequencing throughout the state of South Carolina. We don't just do it here in Charleston, but we have hospitals in several other parts of the state as well. So I think a combination of what DX is doing and what we're doing probably gives us a good view of what variants of COVID are in the state.
And I know you don't have the data just yet, but how do you think the Omicron will actually clinically behave itself?
Well, once again, I don't think we know. We're getting some early kind of anecdotal, just, stories of how it's affected in South Africa, particularly. We're hearing things that it's not as severe an infection, but I don't know what to do with that. I mean, COVID, the thing we worry about COVID is that some percentage of COVID, those infected with COVID, are going to end up in the hospital and some are going to die. I just don't know yet. I hope if it is, it's a mild infection and it doesn't lead to more people being in the hospital. But the bottom line is we're just going to have to wait a few more weeks until we have some data to back this up.
Okay. How are you checking now for bed usage?
Well, we monitor that every day. We actually report all of our bed usage and ICU usage and ventilator use to the state on a regular basis. So at the moment, it's actually pretty good. In fact, the numbers across the entire state of South Carolina are at some of their best levels in the last year and a half. The total amount of COVID in Charleston and in the state of South Carolina is at a low at the moment. Now 6 weeks ago, that was completely different. But at the moment, we're at a low point.
Would MUSC have to limit non-essential or non-urgent hospital procedures in situations where the hospital has less than 10% staff bed capacity?
Well, that's a decision we take sort of day by day. When things do get tight, then we have to figure out should we put off certain kinds of other procedures. But what you always got to remember is, none of that stuff is done lightly because people need surgeries, they need things done. We came really, really close to that back in September, but we did not have to do that. If COVID had kept going on at the level it was going on for even another week or two, it wouldn't have surprised me that we would have had to cut back here in Charleston. But it's one of those things you just have to monitor.
Yes, sir. And what is the COVID level right now here in Charleston?
Well, it's pretty low. It's last number I saw, which was a day or two ago, was about 10 cases per day per 100,000. Now that number may not mean a lot, but it's a number we follow very, very closely. Compared to at the peak back in August and September, we were probably up around 60 cases per day per 100,000 in the Charleston area. And that number was even higher back in January and February of this year. Remember back in January and February, we had a big COVID outbreak here. That number was probably up in the 70 to 80 range. When that number is up 60, 70, 80 range, you will know a lot of people around you who are getting COVID. When it's down around 10 to 15, you may not know anybody, or you may go a whole week before you experience somebody around you that has had COVID. So that's kind of how you know as well. You know the numbers are high if a lot of people around you are getting COVID.
Now, when people come into obviously MUSC with those COVID, experiences, how many percentage-wise, how many people actually have, like, I would hate to say this, but underlying conditions?
Oh, the overwhelming majority. Just about all of them have some kind of underlying problem. Oh, man, sorry about that. Let me just repeat that. The overwhelming majority have some kind of underlying problem. On rare occasion, we may have someone that doesn't have, that they're young and they don't have any secondary issue, but that's rare. People usually have, they're older and they have other medical issues, or if they're younger, they often have other medical issues as well.
And roughly, what is the inpatient and outpatient bed capacity left at MUSC?
Well, actually, at the moment, we have very, very good bed capacity, and it's really not a problem. When we were at our peak, you go back just 6-8 weeks ago, we were full. I mean, in fact, we had some of our highest numbers inpatient here in Charleston that we've ever seen, and I've been looking at this for 20 years. But we had almost 900 people in the hospital. That's a lot of people in our hospital. So we have gotten pretty jammed.
Damn. And what type of equipment would be available just in case this Omicron does come, God forbid?
Well, I think it starts with, first of all, personal protective equipment. Masks, gowns, things like that. But I feel pretty good about that. In the last year and a half, I think we've all gotten more stable around that. But there are other things like just the materials to run tests, to make sure there's enough testing capacity. If you remember, even a year ago, we were having trouble. People weren't able to get tests. So I think that's less of a problem. Of course, if people end up in the hospital, ventilators, rooms, all of those things. If you ask me what I'm worried about, it's not supplies. It's people. So we get very, very stressed with nursing, doctors, just people to man the front desk. When you have a big amount of COVID in the community, people are off sick. So that's probably what I worry about more than anything.
How many booster shots have MUSC actually administered over the past 6 weeks?
I don't have the number. I can get you that number, but steadily we're giving people the booster shots. I just got my booster last weekend. Would highly recommend every adult, if you've been more than 6 months since your last COVID vaccine, you should get boosted. And don't worry about it. I know there's a lot of stories out there that the booster causes symptoms, but I don't have any symptoms. I got it and no problem. And the data shows is about the same as the other vaccines. So I wouldn't worry about it. I would get it, and so you lessen your likelihood of getting sick.
Wow. And my questions are out of sync here, but how many positive COVID-19 tests per week does MUSC sequence roughly?
We do several hundred a week, and it kind of depends. I mean, if we have more COVID in the community and more tests we're doing, we'll do more. But if the total numbers of COVID in the community go down, we'll do less. But it's on average, it's a few hundred a week.
Would it be possible to report whether positive cases are vaccinated versus non-vaccinated? Are you actually collecting that data?
Yes, we are collecting that data. We collect it actually mainly for the hospital. And we know that 75%, and that number is 75 to 80, but the last number we had just a couple days ago was 75% of the people in the hospital due to COVID-19 were not vaccinated.
What is the current vaccination rate here in Charleston?
Last number, it depends on how you look at it, but it's about 70% are vaccinated. But that number sounds high, but Delta, to really push back Delta, was probably going to require us to have vaccination rates in the high 90s. So 70s were not enough to be able to push it back. And of course, we won't know we'll just have to wait and see what happens with Omicron. Omicron may be fine with the vaccination rate of 70, but it may require vaccination rates in the 90s like Delta. We'll just have to wait and see.
What current data, Dr. Cawley, does MUSC have on natural immunity?
Well, it's something we do track, and what we see at the moment is that natural immunity is holding, meaning that if you've had COVID, you're likely to getting COVID holds pretty good. It looks like it starts to wane maybe after about 6 months. So, we're telling people don't rely on natural immunity forever, that if you've had COVID more than 6 months ago, you really should get vaccinated. But there's definitely some benefit to having had natural immunity.
Now, if someone who has had COVID sees their antibodies level drop, would a booster infection be ideal?
I wouldn't recommend a booster infection. I would recommend a booster vaccine. Okay. I think that's the best way to avoid getting the infection. The bottom line is, why take that chance? I mean, you could get infected, and yes, most people will do fine. Will do perfectly fine, but a small number do not. And is that a chance you want to take? And it's the same question we ask all the time with flu, with tetanus, with diphtheria, with measles, mumps, rubella. All of these vaccines, there's only a small number of people that actually get a real problem from them. But if you're in that small number, you just don't know what's going to happen to you. So I think it's the same theory. Get vaccinated, and you keep up your vaccinations if that's what's shown to be effective.
And how many hospitalized COVID-19 patients are there currently at MUSC?
At the moment, across all of our hospitals, we have about 25.
Okay.
So that's a much, much lower number. And I'll just give you at the peak, when in September, when we were seeing a lot of people, we were close to 200 across all our hospitals. So this is much, much, much lower. And even of that 25, these are people that are probably sicker with COVID, and they're here in Charleston particularly because we're able to take care of them, and some other hospitals we're not. So we end up with more COVID patients, sick COVID patients, than other facilities.
And I know this is probably a past tense question, but how is MUSC making sure that the hospital is not being used for housing, essentially for people who don't need hospital care?
Well, we're pretty good at monitoring that every single day. If you don't need to be here, we won't keep you in the hospital. And sometimes that means going home. Sometimes that means going to some kind of rehab facility or nursing facility, or going somewhere else. So that's something we work on all the time. No one wants to be in the hospital if they don't need to be. And we don't really want you here either if you don't need us. We only want you here if you really need the care that we can give.
Right. Would you like to see a traditional vaccine such as Covaxin?
I think with the vaccines, you just have to be. There's a lot of vaccines out there. If you look at the vaccines available across the world, there's a lot of different vaccines. I think the vaccines that are available in the United States are all very good, right? And I would recommend any one of the vaccines in the United States. I don't think you have to go outside of those vaccines that are here. I've heard the arguments for it, but I'm telling you, I've looked at the data. I've looked at the data from a physician standpoint. I've looked at the technology. It's good, safe technology. And in fact, we've now given out millions and millions of vaccines, and we don't see any significant vaccine side effects. So the vaccines that are available in the United States are all good. Just get one of them.
What antiviral medications are ideal for COVID?
Well, it's a great question. So there's really two types. There's an IV form, which has been available now for about a year, and there's different kinds. So if you do get COVID, right, I would highly, highly suggest, particularly if you have another medical problem, that you get an antibody infusion. And those are easily done. Most hospitals can do them. You just contact that hospital, and they'll get you an IV infusion immediately. There are now also oral pills available. They just are becoming available now. There's not a lot of them out there at the moment, but I do think over the next several months, there'll be more of that available. And you won't take an IV. You'll probably take an oral version, which would be easier. It's just like what happens with flu. If you have flu today, all right, you can go to a clinic. They can do a flu test. They can tell you whether you have it or not, and then they'll give you a prescription to go get some oral medication. That oral medication is very, very good at lessening the symptoms of the flu. What we're seeing with these COVID pills, it's almost the same thing. Problem is going to be there's not a lot of it right now. So, and I don't know. I hear the company may not be able to get as much out there in the next couple months. It may be several months before there's a lot available.
And you talk about that. Let's talk about those supply chain problems. How do you address that at MUSC?
Wow, yeah, supply chain, that's really been a problem. It was a problem early on, if you remember, with personal protective equipment and some of the other things. I think we feel better about that. But what's happened, though, in the last 6 months is that we've had other kinds of supply chain problems. Certain kind of components and certain kind of tubes and things we didn't even have a problem with a year ago. Everybody's having supply chain problems. Even retail establishments are having supply chain problems. So we're dealing with it. It seems like every day there's something new. But we have a chief supply chain officer, and he keeps his eye on all these things. I'm hoping this gets resolved worldwide in the next few months.
And when I talk to a lot of people who've had COVID, I always wanted to ask them about those long-lasting, issues with COVID. What exactly are they right now?
Well, there do appear to be some people which develop some long symptoms, fatigue, just no energy. They might have some continuing symptoms of maybe some pains in their chest or their stomach, but everybody's a little bit different. It's something we're going to have to keep an eye on. We don't know much about it. COVID's only been around almost 2 years now. and we just don't have a lot of data. So we'll need to monitor it. We have what we call a long COVID clinic here at MUSC, and we're going to monitor people over time. Hopefully it doesn't happen, but it's not an uncommon problem with some of these viral illnesses. There are other viral illnesses that appear to cause long, multi-year symptoms as well. So it's not a surprise that this is occurring, but exactly how to treat it, we're not sure yet.
Wow. Well, let me turn over to a headline from the Post and Courier. It says this: South Carolina nursing shortage and staff departures continue to plague MUSC as third COVID surge wings. Let me ask you, Dr. Cawley, does MUSC pay their employees enough to live in Charleston and actually deal with these shortages?
Well, I think we pay our employees well. We also have a lot of benefits. We have state benefits and state employment, state retirement, and some other things. So I do think our pay and benefits is excellent. What happened though is that whole article was out there in September, and in mid of August, all of September, and the first couple weeks of October, like I said earlier, it got pretty crowded, pretty hairy here at MUSC, and we couldn't get nurses. We even tried to get what we call travel nurses,
right,
nurses to come in temporarily and work at MUSC. We couldn't get them. So pay wasn't even an issue to try to get more nurses. When these kind of things happen, it's not like a hurricane where things get real bad for a couple days and then it goes away. This thing comes on and stays for 2 months. So it just gets a little tricky to make sure you have all the staff here.
Now, how many pressure-related injuries have been reported to MUSC that you know of?
I'm sorry, Quintin, you cut out there.
Yes, sir. How many pressure-related injuries have been reported that you know of at MUSC?
Well, I'm not aware of any pressure-related injuries. Things got very tight, very crowded, a lot of stuff going on. We keep a very, very close eye on that. There were some nurses and some other staff that were worried some things were happening, but we investigated all of those and did not find any injuries related to that. But it was a time, it was crowded. It was very crowded, and there were a lot of things going on and a lot of patients here. This is the problem with COVID-19. When you have these surges, people think that, I have it, no big deal, and it's a cold, and I'm at home, and I'll get over it in 7 to 10 days. But you forget that a small number get admitted to the hospital, and we got overwhelmed. We got overwhelmed. And as I said earlier, we came very, very close to shutting down parts of the hospital. And if this had continued even a few more days, that was probably going to happen. But luckily it didn't happen. And, that happened to other hospitals around the state. It didn't happen to us. It didn't happen to us because I think we had, and you may remember, MUSC mandated that our employees comply with a vaccine policy. And we got about 90% of our employees fully vaccinated, about 10% put in for an exemption. And I think that helped us. So in a funny kind of way, even though it got very, very crowded, and even though it felt like we were probably getting short, it could have been worse if we didn't have most of our employees vaccinated.
Was the vaccine mandate necessary?
Yes. That was absolutely necessary. I'll defend that any day of the week. Our numbers before we moved into a mandated vaccine situation were about 67, 68% of our staff vaccinated. Once we put the requirement in, we got up to 90%. So, and if you remember what I said earlier, to really combat Delta, you needed to be in the 90s. Now, I would have preferred to have been at 95%. That probably would have helped us even more, but we had only a fraction of employees off due to COVID compared to other hospitals around the state. So I think that was the right thing to do. I know not everybody agrees with the vaccine mandate, but it truly helped MUSC continue to stay open and see patients.
Now, if you were to reach that 95%, would you have eliminated the vaccine mandate?
Well, you remember, we always have new people coming in, okay, all the time. So, I don't see it going away. We do have other vaccine mandates. We mandate influenza every year. We've been doing that maybe about 10 years. We mandate tetanus, measles, mumps, rubella, all kinds of other vaccines. So to me, this is just another vaccine that we need to require. It's a safe vaccine. If I had any concern about the safety of the vaccine, I wouldn't have a mandate, but it does help. It clearly helps.
What is the ratio of the MUSC with the nursing shortage in South Carolina?
At the moment, I think MUSC is affected, somewhat by that. There's historically, MUSC has not had a problem with nursing shortage, but with COVID, we've been affected by this. So I don't have the numbers off the top of my head, but it's something we're working on. We're working to recruit more nurses, and we'll keep it up until the problem resolves.
How safe is patient care in your ICU?
Very safe. Very safe. I think if you're going to be in an ICU, MUSC is the place to be.
What condition is the equipment at MUSC currently?
We have full equipment, full capability, some of the best technology in the nation when it comes to our ICU care.
Does MUSC have any PRNs?
You mean nurses that are used temporarily? Is that what you mean by that?
Sure.
Yeah, sure, absolutely.
Okay.
We have all kinds of nurses on different kinds of schedules. Some take regular 40 hours, some work 36 hours a week, and some nurses work PRN, which means as needed here and there. So it takes a lot of different types of schedules to fill in all these different needs.
Is PTO being reportedly regularly refused?
No.
Okay.
No. One of the things with PTO was we gave people, as part of COVID, when we actually used some of the monies we got from the federal government, and we gave our employees extra PTO to use. We gave it to them back in December of 2020. But as COVID raged in January, February, and March, and then raged again in August, September, October, not all of our employees could use that PTO because we needed them working and they weren't able to take PTO. So we did have a deadline to actually use that PTO, but then because they weren't able to use it, we've extended that deadline in which they can use it. So we want people to use their PTO. We want people to take time off. It helps everybody to be on vacation at times, and we've extended that, and we'll make sure they get their PTO taken.
And going back to those vaccines, Dr. Cawley, how do you all hope to modify that when it comes to the Omicron?
Well, we'll see. It may not need any modification. Yeah. We'll just have to wait to see what the data shows. Once again, I think 2 to 3 weeks, we'll start to have some early data, and we'll know what needs to happen. Do we need extra vaccines, a different dose? Do we need a different type? But we'll just have to wait and see.
And going forth, as far as the future, what 4 ideas would you put obviously in front of the public to say, hey, this is going to be a part of the strategic plan for the Medical University of South Carolina?
When it comes to COVID?
Yes, sir.
Yeah. Number 1 is get vaccinated. This is a safe vaccine. Despite what some people say, it's a very, very safe vaccine. I would say number 1, get vaccinated. Number 2, if you do come down with COVID, if you're diagnosed with COVID and you have another medical condition, I would highly, highly suggest that you get the antibody infusion. It works. It's very, very helpful. And the third thing I would say is that it does help when COVID is raging in the community. We all need to do things like we need to wash our hands better. We need to not come into work sick. We need to get tested early. You may need to go back to wearing a mask. I don't think you need to wear a mask all the time, but when it's raging in the communities, I do think wearing a mask helps. So all the standard stuff we've been talking about for the past year and a half.
Dr. Patrick Cawley, thank you so much for your time. And again, welcome back to Quintin's Close-Ups.
Thanks, Quintin. Always enjoy it.
Likewise.